Good afternoon, everyone. My name is Dr. Maxwell Abraham, and I'm an orthodontist in Leamington, Ontario. Thank you so much for being here. I know you guys are taking time out of your new schedules to join us. I'm just really blown away by the number of people that have registered. It's honestly so great. If there's anybody else that you guys know, any colleagues or any people from your team that you feel like can benefit from this, please just copy and paste the link that you had in that last email, and they'll be able to access this webinar the same way you are. So just to navigate around, there's a comment bar on the side or bottom of your screen, and from there you guys could really just ask any questions that you have throughout the webinar, and at the end I'll be sure to answer everything. And for right now, if you could introduce yourselves, write your names and the practices where you're from, and just so we could all get to know each other, be a little more comfortable. And in the meantime, while you guys are doing that right now, I'm just going to play this fantastic video that Media Street out of Windsor made for us. They really just capture the essence of our office and our team and everything that we really strive to be to our families and patients that we treat. So take a look at that, introduce yourselves, and then in just about a minute we'll rock and roll and get things started. We opened the practice 3 years ago. In that short time, it's just been so incredible to see how much someone's smile transformation can make on their lives, really at any age, from 7 to our wisest patient at 77. A lot of patients, when they start, they may not smile a lot, or they might not like to show their teeth, and they don't even realize it. And then there's this little switch where they just light up. It's that change in confidence, that change in self-worth, and it makes a difference in people's lives, and it's incredible for us to be a part of. We try to remove as many barriers as we can to really open the door for the families to make the best decision that they can. And it's simple things like flat fees, free exams. Our monthly payment plans are customized to the families. We don't even run credit checks. And I think that's why we've been able to really connect with our patients on so many different levels. We started off so focused on creating these beautiful smiles and doing excellent work to really now realizing that it's our work in our community that sits at the heart of who we are. And ultimately it has become really the core of our practice at Abraham Orthodontics, and it's really what drives us today and what will be driving us for many generations to come. So our webinar today is going to really focus in on a lot of our common appliances and our favorite tools that we use for especially kids in the mixed dentition, some things for teenagers as well as adults, and really looking at new technologies like Invisalign to see where do they kind of fit in that big picture of things. And then just review a little bit about our own practice philosophies where we do focus really hard to increase the accessibility to that orthodontic care. So a little bit about myself. I'm born and raised in Leamington. That's my amazing wife, Kristen. Our newborn daughter, Mayella, she's about a month old. She is totally over the whole coronavirus situation, as you can tell. And our son, Josiah, who's 18 months. And, just with that look and that little smirk, you can tell he's been keeping us extra busy these past couple weeks. Since opening our practice in 2016, we have just been so blessed to get a lot of recognition from different organizations, the Leamington Chamber, as well as the Windsor-Essex Chamber of Commerce, with things like New Business, Young Entrepreneur, Young Professional, which has just been so great. But the most rewarding has really been United Way's 40 Under 40 Award. And that has just been so nice as it's recognized a lot of the community work that we've been doing these past few years. We've been going back out into the schools and our community centers and kind of really initiating and supporting different programming in STEM and anti-bullying and nutrition, to not only just give back to our patients, but, their friends and their families and the whole community at large. We also volunteer with Junior Achievement Canada, so we'll go into different schools and provide financial literacy courses, between grades 5 and 12. And most recently, I've been elected to the board of directors at Erie Shores Healthcare in Leamington. So some of our hobbies or that I used to have used to be like running and watching hockey. I'm a big Boston Bruins fan, swimming as well. So I don't do any of that anymore. So I guess the silver lining of this has just been we get to spend a bunch of more time with our family that we know none of us would actually have without the situation. I do sincerely hope that you and your families have all been safe and healthy throughout this, and hopefully we can all do our part in flattening the curve and getting our lives back to normal. So since we've been open, our big PSA to a lot of the dental offices has been really that we want to see our patients by 7 years old. And by all means, we are absolutely not treating all of these kids. I know a really very, very small percentage of them are actually going to need any treatment. We're talking 3 to 4% of them. And that includes, referring them back to you for some extractions or actually doing fixed orthodontic work. The majority of them we place in our free Growing Smiles program, where we see them every 6 to 12 months. When we see them, we're doing a lot of anticipatory guidance for the family to really help them understand and be comfortable with where things are going to be headed, when we want to treat specific things. And, we really just use the latest, evidence-based research to make those decisions with them. I think ultimately what this does is it removes that burden off of the dentist and the hygienist and assistants to answer all those questions at every single recall of is it time, or is it time? When we're giving that information, at least as a team, we all feel comfortable of where things are headed, when we're going to do it, and when that time comes, we're never missing the opportunity to do things when we absolutely should. The most important things that we are going to look for at the age of 7, where we do need to treat, is going to be a unilateral crossbite. So in a case like this, the upper jaw is just a little bit more narrow than the bottom, and the patients will be functionally biting off to one side. Leaving that alone, it can cause that one side of the jaw to be way longer than the other by the time we would see them at that traditional age of 13 or 14 years old. For an anterior crossbite, where the lower jaw is more forward, 90% of the issue is actually with the upper jaw where it's too small. We can only change that skeletally up until like 9 or 10 years old. So if we're not going to see them until 11, 12, or 13, for this small set of patients, we're missing that opportunity, and we're committing these patients to some type of surgical treatment or some extreme dental movements in order to force things to fit, which honestly for a lot of them can be quite anesthetic. If there's anything to remember from today's webinar, it's going to be these two scenarios that we all want to pick up by the age of 7. Other common things we're looking for is going to be an open bite, as well as early loss of baby teeth or teeth that are going to be impacted that you're going to find in the x-ray. So one of the most common appliances that you guys are going to see is going to be an expander. And this is really to treat any posterior crossbites. Again, at a young age, it's going to be more of the unilateral crossbites. We could actively make this change up until the age of 16 or 17. So what we're doing is we're taking these two rings and these two halves of the appliance, and they are actually connected by a screw that's right here in the middle. What that does is every other day or every day, the parents will turn it, and it will actually take the two halves of the upper jaw and physically widen it. After the age of 16, those two halves of the upper jaw, they intermingle and they just become one. So it's not really possible to get that change. That's when a surgery is going to be required right before we use this expander, where the surgeon would go in, re-split the upper jaw to kind of where it was back when they were younger, and then we'd start the same process. And in general, we're really only actively turning for a couple months. We leave it in for a year, and that's where we end up. We remove it, wait for the rest of the teeth, and there we go. Personally, we're really only using this when there's a true skeletal deficiency, in the transverse or from left to right in the bite. A nice side effect of expanders is that we can create some more space for the upper teeth, but I think very, very rarely will we actually use this just for the sake of gaining space. As we are creating some permanent changes to their skeletal complex. Now, Invisalign has been working on different types of products to try to replace this, but in all honesty, there really isn't anything out there that can effectively create that much skeletal change really at any age. So this is an example of a young girl we saw, again, referred to us at 7 years old, unilateral crossbite. We're worried about that one side growing longer if she just maintains that bite over to one end. Her real problem is that both sides are just so mildly narrow, but when she does bite straight on, she can't physically close. The cusp tips hit, so she shifts over. So when we look at the midlines of where the upper and where the bottom are, nothing there matches. After correcting it, so she turned the expander for a couple months, left it in for about a year, took it out, here's where we end up. Again, the younger the patients are, the easily that we can predict that we're going to get this kind of result, where the shifting of the lower jaw, the asymmetry that you're seeing so vividly in the first photo is totally, completely gone. Again, really emphasizing we want to see unilateral crossbites as early as possible. For open bites, we're looking at mainly using a tongue crib. A lot of the times at the young ages, an open bite is going to be due to like a thumb habit, and sometimes maybe their tongue that may be thrusting forward. We always start with non-invasive treatments first. So we're doing at-home things like positive reinforcement. We'll refer them to a myofunctional speech pathologist. We have an excellent one in our community that works out of Bayshore. So if you want that information, please PM us and I can pass it along to you. And ultimately what this does is there's these two bands that sit on the back teeth with the tongue crib. It's our last resort. There's a physical obstacle for the thumb or the tongue to go. And what that does, removing that pressure, everything else in the mouth actually can develop the way it wanted to. And you're going to get closures of bite that look just like this photo we had for this young man here. And that's all we're fixing during phase one. We're really focusing in on the one issue that's there. We know that when he's in phase two, we're going to work on his class 2 bite and the midlines that are off and the tipping of the teeth. But for the most part, I think I'd say 3/4 of the difficulty of his case are easily removed by catching this again at an earlier age. Twin blocks or similar appliances that are used to correct excess overjet, where the upper teeth stick out way more than the lowers, are really just a variation of a multitude of different appliances. So you guys may have seen things like Herbst appliances, Mara's, Forcis. They're all different variations. Some are fixed with springs, some are removable like this. For the most part, they all do the same thing. None of these magically grow the lower jaw. All they do is that when the top part is in and the bottom part is in, they look just like regular retainers. There's little blocks that are there that force the patient to posture and bite forward. What that does is it kind of takes whatever natural growth they're going to have and it uses it all at once. It jumps the bite that's actually fixed in order for their growth to help kind of pass that along to where their bite is to make that change towards class 1. Now, this is going to be limited by the actual amount of growth that patient will have, which is why you'll see that it'll work really great for some and not so great for others. So this young man first saw us at 11 years old. Again, very severe class 2, very set back, lower chin point. And after about a year of treatment, there's a significant change in where his bite is and where his soft tissue profile is, a lot more balanced to his face. He was a great grower. Now, that being said, from here, he's going to be finishing off with full braces to get everything to finish up and match up where we want to go. Now, Invisalign has recently introduced a product that looks really similar to that. So they've taken their aligners, they've added on those same bite blocks that hold the lower jaw forward to create that kind of change in the bite for the patients. Again, in all honesty, it works just as well as the other ones. The patients have to wear it. At least when it comes to the twin block, they wear it during non-school hours. They're never wearing it during class or anything like that, but they are wearing it enough at home and overnight. Same thing with this mandibular advancement appliance. The added benefit though is that we are getting some actual changes to the rest of the teeth at the same time. Personally, I will avoid this if I have a feeling that the growth might not be as positive as we want, just based on a bunch of other different measurements that we'll do. And I find that there might be a potential that we'll have to do some extractions. That's really the one main limitation, of this procedure here. So face mask. Face mask is going to be used for underbites. Again, when the lower jaw is sticking out beyond the upper. What it does is we place a regular expander, same one you guys saw on the slide before. We put that in. There is a post that's connected to a forehead pad and a chin pad that's really only connected to the face between elastics that the patient will put on to connect the expander and the bar. That creates enough traction on that upper jaw to pull it forward. The changes can be quite significant, so a young girl like this, she has some pretty serious recession of that upper lip, where the paranasal folds are really deep and things just look sunken back. After treatment for about a year, there's a lot more fullness in her face and you see a lot more of a normal development of her profile. That being said, there really aren't many appliances that can replace what this does. I still think that this is the go-to in many offices. So if there's anywhere where you're going to see some type of quote-unquote headgear, this is really going to be it. Again, if we're doing this after the age of 10 or 11, we're not going to get the same type of true skeletal change, and it's really not going to be worth it to do it at that age. So again, early as possible, get the biggest changes that we can, and these are going to be long lasting and could really avoid the patient from needing some type of surgery later on. A variation of that same problem is going to be when one or two of the teeth are stuck behind in a dental crossbite. So in patients like these, they actually don't have a skeletal problem. It's just the tooth came in where it wanted to come in. And traditionally these are treated with a couple of braces on the front or different appliances in the mouth. We do a cool thing in our office that I say would work around 80% of the time, where we build a little ramp out of composite that actually acts, I guess, almost like a popsicle stick, putting constant pressure on the one tooth to help it jump forward. It works really quick. We're talking a month or 2 months for the most part. And once it's corrected, we're done. So a young boy like this, who's 9 years old, where he doesn't really have many other issues at this point, except for that one tooth, we're preventing him from having to have any fixed appliances, no worries about hygiene and brushing and multiple visits and the cost of it. It's a simple bite block. We let it go for a couple months. Once he's done, we take everything out and we're leaving him alone. So he's in our Growing Smiles Club and he's probably not going to be seen for braces or anything similar to that until he's 14 or 15 years old. And I think that's an excellent service that we can provide to our families that we treat, to make the whole experience overall better. It's not a long, drawn out, part 1, part 2 treatment. We don't charge $1 for this in our office at all. We do it as a courtesy, just to see the kind of changes we want to see. And again, it can be quite drastic for them and actually more for us. So we alluded to surgery before. We talked about the maxillary expansion and like a SARPI, and that kind of surgery is done before we even start. We place the expander in and it's business as usual. For other types of jaw surgeries where we're looking at bringing the lower jaw forward or back or up or down, we're really starting this off with braces for about a year. and then a surgery is done, and then braces for another year. So overall, about a 2-year treatment, and the changes can be quite drastic. So this young girl, she's had always complained about her lower jaw being set back. Her family never did anything for her when she was a teenager. And finally had the opportunity to kind of fix what's been bothering her whole life. And again, this next picture here is right after she has her jaw surgery, and you see quite a significant change in her chin projection of how much more balance she has to her facial features. So from this point on, what we're doing is we're sending her off to Dr. Sadik after that year, who did a fantastic job with the surgery. And then we're going to be fine-tuning things to get that aesthetic result to be as amazing as possible. So Invisalign. So Invisalign is a really popular tool. I like to say it's the oldest new thing in orthodontics. It's really at this point been around for almost 20 years. The incredible part is that the technology has just been changing like lightning speed. The company does such an excellent job in research and development and in improving the predictability and the ability to really be a true alternative to braces. In my hands, we are committed to making it a real alternative where anything that we can do in braces, I feel comfortable doing with aligners. We've done the extra training, and we've really been committed to making it a part of our practice. So essentially how it works is patients are wearing these aligners for pretty much full time. They only drink water with it. They only take it out whenever they're eating or brushing their teeth. And they're wearing a brand new tray every week or 2 weeks. Every single tray that they change to is going to move the teeth little by little. There's different buttons that are on. They're just made out of composite. These provide the right pressure points so that when the aligners are in, the proper forces are being reflected on the teeth to move them. We do elastics with them to correct, class 2 or class 3 bites. We do a lot of slenderizing where we're filing in between the teeth to make more room for things to fit. A lot of the long-term research with IPR and slenderizing really points to the fact that it really doesn't cause any negative changes to the teeth, especially when it's done within reason. And you have to imagine the amount that we're removing from the enamel is really only going to be about 0.1 to 0.3 millimeters tops around. I think the most you could actually go before you see any negative effects is going to be that 0.5, which can be pretty aggressive. So Invisalign can be done by really any dentist that does the initial certification course, which is just done, over a day or two. I know there's a lot of, even some dentists that are here that do provide aligners for their patients. The difference that you're going to see is just with the level of treatment that can be provided with it to their comfort level. Again, with us in our hands, we've committed ourselves to it. We are a Platinum Plus provider. We're really second in terms of experience from here all the way through London. We do a lot of it. We're comfortable with it. And we do work a lot with some of the local dentists that do provide it in their office, to help them pick up the cases that are going to be predictable for them and kind of fall within their scope of how they want to incorporate it into their practice. So you are going to find that range. So, we'll see a lot of patients that will come in who've been told that Invisalign is not for them or it's not possible, and we are able to do it. And it could be really any type of case. So we're talking class 2, class 3, open bite, deep bites, pre-surgical. There's a whole range. So with some of our young patients, we have things like elastics that are incorporated in it. They're worn the same way they do with braces. So this is a 15-year-old boy in our office who's just really blessed to have these beautiful front teeth. They're pretty well aligned, great smile, great everything, but just has a pretty severe deep bite, and he's pretty moderately class 2. And again, after treatment with Invisalign and elastics, in about 1.5 years, this is where he finishes up. So you have a great class 1 occlusion. Aesthetics are still maintained on his upper teeth, but he also doesn't have that deep bite. Leaving the deep bite like that for so long over time is really going to wear down the incisors on the top and bottom. So we've all seen 40 somethings or 50-year-olds who have teeth that kind of look like chiclets, or they've just been chopped down almost in half. A lot of those same people started out with bites just like his, where they may have looked okay, but again, the bite depth that's there and the overlapping of the teeth is something that's going to cause some long-term aesthetic damage for them. Again, one of our other teens who was just hilarious, she came in, her big concern was actually with her lower crowding. She called it a graveyard or a bunch of gravestones that are falling on each other. And she was in aligner treatment for about a year. To me, what I think the biggest change has been where she had this canting of her upper teeth when she smiled. So the lower, the upper teeth were kind of lowered asymmetrically, where she showed more gum on one end than the other. And that's one thing that I actually love aligners for, is being able to intrude specific teeth back up into the bone and back up into the gums. And within a year, there's a change that we see for her. So the graveyard is completely taken care of. On the top teeth, we see a lot more balance in where her gingival lines are relative to her upper lip. And that is a $1,000,000 smile right there. Now with adult patients, our philosophy is a little bit different. So again, we're always going to have that 20% of the adults that come in that want everything absolutely fixed to perfect. And they are willing to do extractions, they're willing to do surgeries, they're willing to be in treatment for 2 or 3 years. Then you have the rest of them, that come in and they really just want that one specific thing fixed that has bothered them their whole life. Traditionally in orthodontics, it's always been pushing towards a comprehensive treatment. Our philosophy is a little bit different, where we've really come to realize that if the bite is stable and if things look good on the top and bottom, we're okay with leaving that if it's going to allow us to make the change that we want to give our patients so that they can be confident, they can be happy with their smile, especially in this day and age with selfies and photos up the wazoo. These things are becoming more and more important to people, and I think we do a disservice by brushing that off. So, this young man was just about starting his real estate career. He's in his early 30s. He was lucky to have a class 1 bite to begin with, but a lot of crowding. And again, with him, he had some pretty major chipping on the front teeth. So a very common service we'll do for a lot of our patients is filing those edges of the teeth within reason, especially if there's a good amount of enamel, in order to avoid any restorations later on, because really we all know that these are going to be a nightmare to fill and maintain and look aesthetic. Now, the problem with him is that we did it before we even started treatment. So luckily he was a good friend of mine, but the day we did the filing, he got up and he was just like, well, I don't know, I'm kind of happy with where they are right now after doing the filing. So again, luckily he was a good friend. I kind of really highlighted a lot of the crowding issues he has on the bottom. And I'm really glad I did, because his results turned out fantastic. Again, with the aligners for about 1.5 years, that's where he ended up. And I still will take credit for his real estate career really kind of just exploding for it. So one of our limited cases, this is a JK teacher who, I've personally known almost my whole life, who surprised me when she came in one day, really talking about how much her front tooth that sticks out has bothered her forever. I was even more surprised that her JK students laugh at her about it. And I guess it's really just a sign of the times of where things are at. But, she's close to retirement. She was taking a big Euro trip, the following summer, and really just finally wanted to be happy with her smile and with her teeth. So we completed this treatment in about 1 year. And this is a case that on the first glance to a lot of people might look a little bit more on the simple side. This is something for the dentists that are doing Invisalign in their office. I really would shy them away from situations like this. So when there's a lot of tipping of the teeth towards each other, Invisalign, even though it can be done, it can be quite unpredictable of how to get to the finish line. For her, it took about 2 refinements to fully get that tooth back to where we really wanted it to go. So it's not going to be a 4 or 5 aligner type case. For something like her, it took a total of almost 35 aligners to get there. But at the end, like I said, it's worth it. This is a change where she never thought would have been possible. She's a severe class 2, would have definitely benefited from jaw surgery. But this is really all she wanted. And we've had similar patients like this that will come in, especially where they've only ever been told that, yes, they need jaw surgery or they need to have certain extractions in order to fix what really bothers them about their teeth. Again, if we can create this kind of change in their life, I think that's really exciting. It's so rewarding. And, the number one things that the adult patients will say is, God, I wish I would have just done this earlier, which I don't argue too much with because I wasn't around earlier. So we just kind of brush it off and say, well, thank God we did it now. So these are my absolute favorite cases. The ones that require a lot of interdisciplinary work between the dentists and oral surgeons. So this man, in his mid-40s, we've been treating his daughter for a while. And one day his wife surprisingly dragged him in and she had enough. And remember, this is pre-coronavirus home quarantine days. So she married him like this. He's always had just the one tooth in the middle. He never even wore a flipper. And so they were definitely committed to getting a implant done. So we went back, we worked with the dentist off of our 3D plan from our iTero scanner, where we can get this 3D model of the teeth and really work with it to find what's going to be the perfect amount of space to get the restoration that his dentist wants and the proper amount of implant space that the surgeon needs. So from there, if we flash forward 6 months, we end up where everything is actually set up quite well. He didn't want any treatment on the bottom. The crazy part about all of this is that from day one, where that space is, he had a false tooth built into his aligners that we filled with a white filling material. So he left our office the day he got aligners with a tooth in that spot. And as time progressed, it got more and more accurate to how things are going to look like at the end. And, from many different standpoints, it really helped kind of relay that point to him of where things are going to be, but also for the dentist to kind of look and check to see how things look aesthetically and if there's still any further changes they want to make before things are finalized. So he had a beautiful restoration place from his dentist. The implant went really well with the surgeon. And, again, this is a really, really far cry from where he was. His wife was ecstatic. And, my prediction is after all of this is done with the virus and us being in our homes, we're going to have a ton of unhappy wives coming in wanting us to fix things about their husbands, and it definitely will not be limited to just their teeth. Again, one of our other Invisalign cases, this young man has had this amount of spacing with his teeth since he was younger. Some of it's secondary to an old thumb habit. Within a year of aligners, we're getting that fixed. And, you look at him and you look at his smiling photo, and we comment about this all the time in our office of how that right there is confidence. That is somebody who is damn proud to be smiling, whether it's for photos, whether it's for, in social situations at work, whatever it may be. That's it right there. This is why we do the treatments. I can't really understate how much this changes our patients' lives. If you go back, we get tagged a bunch on Instagram on people's befores and afters and stuff. And I'll always try to scroll back and look at their old photos and see how things looked. And they're never smiling, ever. Their lips are pressed and they're avoiding it, or, the girls are really smart with angling things a certain way, or super high flash. So you look and, there's the time they get the braces on, a couple of weeks after that, then all of a sudden in all their pictures, they are ear to ear grinning. And it's this pure happiness and joy that, when our older patients get this work done, they've lived with the burden of having that smile their whole life. that they appreciate it so much, and it's so rewarding, for us to be a tiny part of that. I would say right now that our adult patients are about, 50% of our practice, and we enjoy it quite a bit. Even for small things like this, black triangles, such a pain from a periodontal standpoint to even remotely get that fixed. Even restoratively, if she were to get crowns or veneers on those teeth, it still might be unpredictable of how those gums will react. So as part of her overall treatment, slenderizing and reshaping those teeth can create that proper fill that's going to be there. Again, you don't get any food traps. It doesn't look like there's always a hole in the teeth, and it can create quite a significant effect. So to finish off with our cases, one of our funnest one has been with Tina here. And Tina is just such a wonderful person. We've known her for a very long time now. She has probably the greatest kids that anybody could have. She's walked around her whole life with a smile like this. And if anybody knows her, her personality and her positivity and outlook on things are 20 out of 10. So she's finally wanted to do something about her teeth. Now, we look at this underbite and it screams surgery at us 1,000 times over. Again, with our specialty training, kind of really getting at the root cause of where things are, we actually find it's not as bad as it looks. She actually postures her lower jaw forward because those upper teeth are a little bit more sunken in than normal. So they're kind of leaned back towards her throat. So over time, her teeth have sort of just worked around this kind of fake jaw position. But when we put her in CR or centric relation, or the most relaxed position of her jaw, things aren't as bleak as they look. So she actually opted to go for braces. She wasn't interested in really correcting that space just yet, but a part of our plan with her dentist was getting that space large enough for a future implant and bone graft down the road. This is where we end up in about 2 years. And again, what a change for her with her profile, with her smile, how things project. The best things about a lot of these crowding cases is that their teeth naturally look whiter. The way that the flash and the lighting hits their smile, it shows properly. No amount of whitening is going to get her old smile to look white the way she wants in those Instagram photos or Facebook or whatever. Again, this right here is just an excellent change for someone who's finally now to take how they feel on the inside to really wear it on their sleeve, wear it proud. And yeah, we couldn't have been more happy with how this resulted out. Retainers are a big question we get. I've honestly this year had about 3 patients just absolutely shocked that they would need something to hold their teeth after. And it's something where there's been a lot of research into this. Extractions, no extractions, certain types of treatments, certain types of braces. Nothing makes a difference. Doesn't matter what you may hear, what you may think. The consensus is retainers are absolutely for life in order for the teeth to stay where they were when we finished. We always put a clear retainer. We don't use any fixed bars unless it's a patient request. The reason for that is, as all the hygienists and assistants will attest to, is that it sucks. It picks up so much plaque after about 5 or 6 years. The majority of them are removed because they become such an issue, and then the patients are left with nothing. The teeth shift, we're back at square one. So we really don't encourage it, and the beauty of these clear retainers, and again, this is something to share with your patients that you see, that may have had braces 5-10 years ago, is that if they put the retainer in and it feels a little tight, it is a good time in their life to wear it. Because it just means that their teeth are in the process of shifting and moving around, and they need to be wearing it maybe a little bit more full time during that phase, whatever that phase may be. So I like to say that teeth are like wrinkles. They're going to shift, they're going to change and crowd on each other. And it's going to happen at different points in your life. So again, a lot of our patients are educated to self-evaluate that after the fact in order to know when really they should be wearing it and when they're kind of in the clear. And that's going to be like a cycle going up and down throughout their life. Cost is a huge thing. So we talked about how incredible the changes are and how it could really impact their lives. When the patients first come into our office, 100% of them are worried about the cost. And no virtual imaging and befores and afters are gonna make them blind to this. So it's always been our goal from day one to really remove all the barriers to care. We do free exams for all of our patients, free follow-ups, whether it's part of that Growing Smiles program, or if that person just needs more time, or if it's an interdisciplinary case where they're going back and forth to different offices. We also charge the same fee for Invisalign. We want to make sure that our patients have the access to whatever treatment they want. We work with the families to find out what's going to work for their lifestyle. Are they a very forgetful person? Do they lose their glasses and their phones all the time? We're not going to give them aligners, realistically. If they're a crappy brusher and hate how metal looks, they're probably not going to wear braces. So again, removing those cost barriers really help them to make an informed decision of what's going to be best for them. So with that cost, we offered, really flexible payment options, no interest, monthly. A lot of the times there's no down payment. We again work really hard to make sure that our practice that gives this, quote unquote, Ritz-Carlton experience is really accessible for everybody. And, other ways we do this is with our phase 1 treatments. They are just broken off of our flat fee that we charge for our comprehensive cases. So those patients that are doing a part 1, part 2 are never paying anything more than anyone else. And again, this is very different than what's traditionally done, but for us, it really helps keep us not only honest, but it keeps the patients aware of how important these phase 1 treatments are. The expander, the face mask, where if we're humming and awing a little bit on, is it worth it or is it going to be too much cost? It's, we try to remove that cost burden there by saying, hey, you know what, this is all part of a bigger picture, but for right now, this is absolutely what we need to do. Again, the whole point of this lecture is to really help your teams be so comfortable with orthodontic treatments in their office, able to talk about it with the families, having that synergy in what the patients are hearing and what they're instructed to do and what's important or what can wait, really leads to better outcomes and better experiences for our patients. And, we really encourage you guys to invite your patients to our practice. You really can do it any way that you are currently doing it now. So a common way would be through the paper referral pads that can be faxed. Also online, if you click on send a referral on our homepage, you will get a digital version of that same referral pad. And you could also even update your pan that's there. So we've been complimented and just the amount and level of communication we have with our other dental offices and other specialty offices. And it's honestly second to none. And a real big part of that is this login capability that you have. So you use your office email, you would log into it, and then from there, you have access to all of your patients' records. And you can look through their files, check out all their photos, all their x-rays, all the correspondence or referrals that we may have sent back to you. Everything is going to be in there. We have quite a few offices that really use this quite a bit, and it just makes life so much easier for their office administrators and treatment coordinators. And, again, for that peace of mind, we also send every single x-ray that we take directly to you, whether you use this service or not. And when it comes to any referrals that come back to your office or referrals out to oral surgeons or periodontists that we've already checked with you, We are taking care of all of that before the patient leaves. There's never anything left in limbo. Helen, who is our administrator and receptionist, is the definition of customer service. Nobody ever leaves our office with a single doubt or a single question in mind about any process, whether it's insurance, whether it's setting up other plans or coordinating things between offices. We strive very, very hard to make sure that everything's all preset and there's no gaps at all to care. So we are so active on social media, and I really encourage you guys, especially on Instagram, to follow us. During this break, we've had a lot of Q&A from future and current patients. We have them in our highlights, so you can kind of see a whole summary of all the questions we've been asked. A lot of them have to do with whitening, to be honest. So, and just kind of see how that interplays with aligners. I guess one point to take home from all of that is that yes, you can do whitening while you are in Invisalign treatment, even if there's buttons on the teeth. The hydrogen peroxide can get underneath the buttons and whiten the surface. So that is definitely a question that you are going to get. We get it twice a week in our office. So our team that we talked about, so there's Helen right here holding a baby. And again, a lot of your teams are already going to be familiar with her. She is just, our best foot forward on really connecting with your offices, connecting with our patients, being that liaison. Our dental hygienists, we have Sarah, who moved from London to join our practice. She was at one of the best offices in the city. She's originally from Stony Point, joined our practice, and has really brought a lot of her just natural skill and connecting with patients, connecting with families, and really improving outcomes by really being that motivator, that leader, and making sure that the patients do their part in their treatments to get the best results possible. Carolyn's our newest member, again, originally from the area, moved back home, interested in orthodontics, same idea, and she's just been this ray of light that has really tied our whole team together. And both of them clinically really take care of everything in our practice. And we're a very tight-knit team. We're very efficient, and we pass along a lot of those efficiencies to our families, again, to make it accessible, to make the experience as incredible or amazing as it could be. So thank you guys again so much for joining us today. I know you're all taking time from your new schedules to be here. So again, I really appreciate it. And honestly, I really do just invite you guys to come visit us at the office, to really get a nice glimpse of, the kind of experience that we're providing for all of our patients. And, we're right in the heart of Leamington, Oak and Erie Street, across from the old Heinz, which is now Highbury, still makes ketchup and baby food and such. And I also left my own cell phone number there too in the bottom. So any questions you have about the presentation, please just reach out to me. I'd love to go over anything else that you may have in detail. Any dentists that do aligners in their office, I really open that invitation to you guys to really just be a resource to help you out with anything that you may need for those cases, whether it's kind of picking out the right cases or kind of getting over any speed bumps that you might encounter. We already do it with a lot of other offices. Please feel free to reach out. We'd love to be a valuable resource to you. We're going to look at the other questions that have come up and stuff throughout the seminar and try to answer them. So let's do that. Okay, so we have one question here from Isabel, and she asked if we prefer using Holly retainers or Essex retainers. And generally, just in my hands, I always prefer the Essex retainer. It's more aesthetic, it's clear. I find the patients will actually wear them when we ask them to. The Hollies could be great in specific situations, especially if there was a lot of expansion. again, I know sometimes I have seen teeth sort of walk away from the retainer depending on the kind of bars that are there, as well as extraction spaces can commonly open up. So again, in general, in our office, the X6 retainer is there. It's very easy to explain to patients, especially if they get some small movements from not wearing their retainers, they know that they can just put it on, wear it full time again, and it will actually move the teeth mildly. The second question we have here has to do with the retention plan for the black margins, or sorry, for the open gingival margins of the black triangles. And again, we're using our regular retention plan of an Essex, even for those situations. So the patient there that we showed, they just have a regular Essex retainer. Now, sometimes if we do find with anybody that has had some type of diastema, we will put the bonded retainer. And, just to elaborate on that a little bit more about the hygiene, we strive so hard to really encourage proper oral hygiene in our office. So, the day that we will, the day that we'll put the braces on, we will automatically refer them back to your office for a set schedule cleaning. That your office can go ahead and schedule, whether it's every 6 months, 9 months, or even 3 months for certain patients. So when they do come to see you, especially for a lot of the hygienists that are in here, really encourage the interproximal brushing after every meal. Those are all going to be very critical for keeping things there. We usually give them 2 chances. After that, we will take out the wires and wait for things to improve before we start up again to prevent some permanent damage. So if any other questions do come up, please feel free to send us a message. We will have this whole stream available again if you have anybody else that you would want to share it to. We've had this crazy response. We had about almost 150 people register. I'm just so blown away. And there's a lot of names here that I'm familiar with, and some I haven't seen. So hopefully we could all meet each other in person soon. We do plan on doing more of these, and it won't just be orthodontics. We do plan on bringing other speakers, other specialists in. So if you guys do have any questions, please, or any recommendations of topics and stuff you want covered, again, please let us know. And it looks like there's one more question here about Tina. So for Tina just only had the braces on. Now, in order to stop her from biting in her underbite, we made some really large posterior bite blocks on the very back of her teeth. So she wasn't really able to close down